Special patient populations. Please take a moment to review the learning objectives prior to completing this presentation. Pediatric patients present a wide variety of problems. For one thing, their veins tend to be much smaller and much more fragile, so you may be required to use a smaller needle or a butterfly. You're going to make sure to use pediatric collection tubes. These collect a smaller volume of blood and are more appropriate to smaller patients. ELMA is an anesthetic which may be prescribed by the doctor. It should be applied to the arm approximately an hour before the blood is drawn. Please keep in mind that unfortunately, this will sometimes make the veins more difficult to find. You should constantly reassure the patient and the family. Often if you can get mom or dad to calm down, that will help calm the patient as well. You should be gentle and calm. You should be honest. Never tell a patient that it won't hurt. You are sticking a sharpened piece of metal into the patient's arm. It's going to hurt. Tell them it may hurt a little bit, but it will be over before you know it. Try distraction techniques. This works very well. Have them look at pretty pictures on the wall or have them look at mommy. The less they're concentrating on what's going on with their arm, the less they're going to be aware of when the stick happens and the less likely they are to actually react. Sometimes it takes a little extra work to secure the pediatric patient. For smaller children, there is a device called a papoose where you can basically swaddle them in and leave only their arm exposed. This keeps the patient contained and more calm. For an outpatient setting, have the parent sit in the chair, put the child on their lap, have the parent wrap their leg around the children's legs. I have seen kids kick a phlebotomist more than once, including kicking the hand that was drawing the blood and causing problems. Mom or dad should hold the other arm. In particularly small or combative patients, having a second phlebotomist or another person, nurse or other staff, holding the patient's arm securely while you're drawing it can help a lot. I've seen it take 4 full-grown adults to draw a 2-year-old, and it was all they could do to hold her still. Nursery patients often have additional identification that must be considered. For most babies in the hospital, they are named simply by their gender and then the mother's last name. They often have an additional band that contains mother's name or a special identifying number that corresponds to a band on the mom. You must include this information. There could be 4 or 5 baby boy Smiths in the nursery at any given time. Special precautions must be taken for infection control in the nursery. Additional hand washing or other decontamination procedures may be required before entering the nursery area. Venipuncture can be extremely dangerous on neonates. Dermal puncture is definitely the preferred method for most routine testing. Especially in premature infants, extremely small volumes must be used. The minimum amount of blood must be drawn whenever possible. In babies whose total blood volume is very small, anemia can result simply from being drawn a number of times. The hospital I trained at had a neonatal intensive care unit, and every morning we had to prepare donor blood for every milliliter of blood that was removed from the child for testing purposes. Hearing impaired patients, whether totally deaf or merely partially unable to hear, present a lot of problems in communication. You should always face the patient when speaking. You should raise your voice, increasing the volume, but do not yell. Yelling distorts the mouth and lip readers will have difficulty. Use paper and pencil if necessary. Those who are visually impaired require extra communication. You should always speak to the patient as you are approaching. You should describe to the patient what you are doing at every step. Long periods of silence can be particularly frightening when you don't see what's going on. You should always guide the outpatient into and out of the lab and make sure that they have a caregiver who can help them get where they need to go if they are not independent enough to do so themselves. Geriatric patients also present with a wide variety of difficulties. They may be partially or fully hearing or visually impaired. Their skin may be particularly thin and fragile, and they may bruise easily. Their veins may be small and hard. They may be sclerosed such that it is hard to get into the lumen or the opening in the center of the vein. They may suffer from emotional problems, confusion, or dementia. You should always speak to older patients with respect and care. Avoid terms such as dearie and honey. These can be rather demeaning. Patients who do not speak English are very common. For those who do speak some English, you should speak slowly and in a normal tone. Try to use words that are easy to understand. Remember that if the patient does not speak English, the patient does not speak English. Don't resort to typical American rudeness. If they don't understand the language, it doesn't matter how slow and loud you say it. You should use nonverbal language as much as possible. Pointy-talkie usually gets the point across. If at all possible, try to find an interpreter. Often a patient will have a family member with them who speaks at least some English. Difficult patients describes a wide variety of people. This is something you'll have to learn to deal with on a case-by-case basis. The one thing you should always do is to remain calm and professional. Don't take it personally. It may simply be that they are tired. It may be that they are sick and they don't feel well. They may be frightened or concerned. Unfortunately, they're going to take it out on whoever's around. If they are upset about something specific that's been going on, apologize and attempt to rectify the situation. I'm sorry, Mr. Jones, that you've had to wait so long. We try to give our patients all the care and attention that they need, and I promise that as I get to you, I will give you that same care and attention. Attempt to rectify the situation as calmly and quickly as possible. You should remove disruptive patients from public areas, taking them someplace private to address their concerns if at all possible. You are not required to take physical abuse. Unfortunately, verbal abuse is almost de rigueur for this profession. You'll have to just learn to grow a thick skin and get past it. If a patient physically abuses you, you should know what to do in advance, and you should report this to your administrator. Dialysis patients present problems in drawing them. If you are drawing them from a cannula, you will need to follow line draw guidelines. The nursing staff should have to do this for you. You should never draw from the dialysis fistula. You'll be able to tell it's a large circular vessel, usually in the patient's forearm. There are some patients whose graft has grown shut and you can use it, but you should always check with the nursing staff before doing this. The biggest problem presented by the homebound patient is that you have to be very careful with the patient identification. Don't rely on the fact that they're at the correct address and assume they are the correct patient. You're going to need to have some sort of photo ID to make sure you've got the right person. You need also to make sure that you have all the supplies you require, including extra needles, tubes, band-aids, etc. In case you have difficulty, you don't have a supply closet handy. You should take in everything you need and leave only the band-aid. You must remove all equipment, especially sharps hazards and biohazardous materials. It is important that you label the specimens properly at the patient's bedside prior to transporting them.